Hello, my name is Samantha Whitman. I'm from Arizona State University, and I'm here on behalf of my team from ASU and Mayo Clinic to talk about our paper, Bodily Experiences of Illness and Treatment as Information Work, the Case of Chronic Kidney Disease. So CSCW and adjacent fields have previously investigated the information work that patients do in relation to their health, illness, and treatments. And here we're defining information work as practices patients engage in to gather, organize, make sense, and act on previous and current information related to their health. These information work studies have explored burdens of patient work, especially those chronically ill, in addition to the collaborative information work between patients, caregivers, physicians, and peer networks, and many also focusing on practices of both tracking and self-tracking. And many of these studies also, in fact, point to the need for more nuanced, in-depth examination of bodily experiences as part of information work. And here we define bodily experiences as the lived through physical sensations of patients managing disease and treatment. And though research has investigated these dimensions of patient work, as described, there still is a need to extend research on the relationship of patient labor and managing illness and treatment within the US healthcare system outside of tracking and self-tracking practices and technology. And our work contributes just that by shifting the focus on understanding the labor on how bodily experiences play a role in information work. We do this through the case of patients managing advanced stages of chronic kidney disease. And so we describe in detail the information work practices these participants engage in related to the physical bodily cues experienced while managing their illness and treatment of CKD. And we use these insights to inform researchers involved in the design of health information technology and healthcare processes to support complex and crucial information work, practices, challenges, and contexts. And we approach our work with our research question: what is the information work that chronically ill patients do in relation to their bodily experiences as part of accessing, carrying out, and managing their disease and treatment? And to quickly go over some context about our case of chronic kidney disease, which we go over in more detail in our paper. CKD is a chronic disease marked by limited to no function in one or both kidneys, with 37 million US adults reported to be diagnosed with it. And patients with advanced stages of the disease undergo intensive renal replacement therapy treatment, which takes multiple hours and days per week. And these renal replacement therapy options include dialysis, which is the manual removal of certain waste, salt, fluids, et cetera, from the blood while being hooked up to a dialysis machine, or organ replacement via kidney transplant. It's also worth noting that CKD is not much described in CSCW research and related disciplines, despite being a major source of morbidity in the population. So due to its prevalence and large impact on those diagnosed with it, we recognize that CKD patients were an ideal and important population for further studying patient work performed by chronically ill patients. Next, I'll quickly review our methods, which are also described in more depth in the paper. We conducted our research by recruiting participants who were prescribed with long-term dialysis. And also four of our participants had eventually reached post-transplant care by the time we reached our data collection stage. And ages ranged from 25 to 87 years old. Our data collection analysis used qualitative methods, and we ended up with 32 semi-structured interviews. And 4 out of the 32 that were interviewed, we had conducted observations with those participants for a more theoretical richness of the data. And thus, we had sought those individuals out to observe them with a variety of treatment options or situations and contexts. Using an interpretivist approach, specifically also grounded theory, for analysis, we tacked back and forth between data analyses via coding and literature, identifying key categories in the data and comparing the categories to one another. And from this process, we had developed the themes articulating different but interconnected aspects of information work related to our participants' bodily experiences of illness and treatment. And the themes that emerged from our data were bodily experience of chronic kidney disease, making meaning of bodily experiences through experiential learning, communicating bodily experiences, and attuning daily life around bodily experiences, which I will now briefly go over next. So bodily experiences of the disease itself. These were sensations deeply woven into the lived experiences of CKD and were ranging anywhere from mild to extreme discomfort and included sensations such as fatigue, exhaustion, pain, thirst, and etc. And for example, this patient here had described what they were physically feeling and living through up until the point they started dialysis, of feeling tired and stiff and hurting to the point where they describe it feeling like a train had hit their physical body. And again, all up until they had begun dialysis treatment. Next, we found that participants were making meaning of bodily experiences through experiential learning. Unfortunately, these lived through sensations and events were associated with these experiences that needed to be translated and made sense of. And a lot of times this was done through a trial and error process. And such as this participant here that we see on the slide, it took up to 7 years for this participant to finally get their treatment to a T, to the point where it was best suited for them and their situation and their circumstances. And this is sometimes very apparent and something that lasts a very long time and that we saw in our participants. Third is the theme of communicating bodily experiences. So this is where we saw collaborative work come to fruition in just about every instance with our participants' information work practices. So patients were interpreting and learning what was happening with their body, but also when to actually say something about it and to who. So we can see here, like with this participant here, they were experiencing a lot of discomfort even after their surgery had quote unquote gone well after putting in a catheter for a port to do their dialysis. And this participant had reached out to the proper healthcare professional, and they went in for a surgery to check to see if everything was okay. And lo and behold, her surgically inserted catheter was dangerously located and being wrapped around her intestines. So without speaking up and reading the physical cues of her body and reaching out to her nurse, more complications would have potentially happened as well. Lastly is the theme of attuning daily life around bodily experiences. So using information of feeling, interpreting, and communicating experience, patients attune their lives around the information that was gathered and try to understood from these physical events. For example, this participant here is a great example on how she had made up her mind on what was important in her life and how to attune her treatment to what was important, which was being able to be at home with her pets and sleep with them in the same bed, and deciding what kind of dialysis treatment was best suited for that, and found that through discussing that with peers via online forums and also her healthcare professional team. So with the 4 themes related to this information work of our participants, we show how patients are continuously engaging in information work in relation to their bodily experiences, all the way from pre-diagnosis to carrying out their treatment plans, leading to solo and collaborative information work to attend to those physical sensations that lead to elicited complex labor. Also, patients received little information directly from their healthcare professionals in many cases of our data, and which led to that very difficult and unfortunately painful trial and error learning process, which would take anywhere from a few months to a few years. And lastly, we also want to highlight that information work being centered around bodily experiences is crucial to patients' adoption of new ways of life, which are congruent to the demands of their diseased bodies. And these 3 things are also important to consider when in our discussion of design implications, which we propose that technological tools and communication systems should support information work by prompting ongoing awareness of bodily sensations, reflecting on patterns or changes in bodily experiences over time, coaching patients to communicate these physical events to the proper healthcare professional or caregiver. And furthermore, consider the value of social computing tools to better support information work practices through collective sense making. And finally, another key consideration for design implications is that technologies should support information work related to again, bodily experiences, is the ongoing devaluation of patient knowledge within medical care, and to consider the power imbalance between authoritative knowledge and lay expertise, and how can they work together to best support patients and how they're managing their illness and disease. So we want to thank you for your time, and please feel free to reach out at any time for any questions, concerns, or comments. Thank you again.